Hello, hello, everybody. It's Chris. We're back for day 3. I'm hanging out here in my Zoom room. Would love to have you come join me. So if you need the link, go ahead and take a look inside the Facebook group and you will find the link to join me inside of my personal Zoom room. And I'm here. I'm here to answer all your questions. I know I had somebody who just wanted to pop in. I heard a doorbell and just wanted to let you know that if you didn't get right in, try again. I was actually doing whatever I needed to do to kind of get this to stream to Facebook. So would love to answer all your questions about In-Demand Health Coach. So remember, we focused on a lot of information in 2 days, definitely. And I want to just let you know that it's totally awesome to still have some questions. Like this is something that, it has allowed me to work on over several years of building and growing my practice. And so this is something that you might be learning that's brand new for you. This might be a technique or a strategy or just new information on how you can actually grow a thriving practice by collaborating with doctors and holistic health practitioners. So I'm here. I will answer any of the questions that you have. I really would love to have you join me inside of the Zoom room. That way we can just really have a conversation. And the reason why is because there is a terrible lag on Facebook. So yay, here's Michelle Sullivan. So welcome, Michelle. So glad to have you here. So there is really a lag on Facebook. And so it doesn't allow me to really see in real time what is going on. So let me know, just pop on here inside of the Zoom room. I see Felicia, I see Aisha, I see Rachel, I see Michelle. So even though I can see you here, pop on over into the Zoom room if you want your questions answered specifically. And if you don't, or if you can't do that right now, I get it. Type your question in the chat and I will go back and forth in between being here on Zoom and then taking a look at any questions that are in the chat. So, hey, Michelle, how are you?
Good. How are you, Chris?
Good. I'm so glad you're here.
Me
What
too.
questions do you have? Or do you have any questions? Or do you just want to pick my brain today?
I would love to pick your brain.
Awesome.
So
Yeah.
I am just trying to make sure that okay, I'm trying to figure out, this technology stuff, you handle it so well.
Oh, girl.
Like
Thanks for
Monday.
saying, but I get knocked off and all the time. Like stuff happens and I'm like, I think I'm talking. I think it's going live. Not real sure.
Yeah. So I think I want to go back to Monday
Mm-hmm.
when you were talking about collaborating with the doctors and healthcare practitioners and that type of thing. Is it, I have a certification as a health coach and a life coach, and then I have the mastery certification as well. Is it really important that you have more certification if you're wanting to work with healthcare practitioners?
No, it's not.
Could you explain a little bit more about that? Because
Mhm.
I'm wondering if I need to go back to school to get some more certifying before I go and talk to a healthcare practitioner.
Yeah, no, you don't. And here's why. Let me speak to this. We are not diagnosing, we're not treating, we're not curing. We do not, and we are also not positioning ourselves as, um, what's the word, registered dietitians. Okay, so there's a difference. So you don't need, and again, honestly, and I don't know why, but nobody ever questioned any of my credentials. No one ever said, so what makes you the person to be able to talk about this? They were just really glad to have somebody that could actually share the information. And the fact that you are a certified health coach and life coach is plenty, is plenty. You are a certified health and life coach, which means that you can absolutely help people in the realm of lifestyle, habit change, And we can absolutely talk to people about, what it looks like to have a healthy plate. What does it look like to set up, a good sleep schedule? What does it look, because we're not giving them specific information nutritionally, personally, right? We're not saying you have to eat this type of protein, you have to eat eggs every morning, and we're not giving them, what's the word I'm looking for? Like a meal plan specifically tailored to them, if that makes sense. We're basically saying, look, this is a healthy plate. This is what it looks like. We want to have healthy carbs. We want to have healthy fats. We want to have healthy protein. Boom, boom, boom. This is what falls in those categories. So we're speaking in general, and that is actually public information, and you absolutely can do that. Even in some of the orange states that are out there in red states, right? I know sometimes I get asked this question all the time, by the way. What if you're in a red state? Can you still teach this information? Yes, because it's public knowledge. What we're sharing is not specific to an individual.
I've not heard of the colored states before.
Mhm,
Could you break
mhm.
that down for me?
Absolutely. So, in some states, and North Carolina actually used to be, and when I was building my health coaching practice, actually, it was an orange state, which meant that the only people that were allowed to give nutritional information personally were people that were registered dietitians. It meant that the state had a specific track that said that you had to be a registered dietitian if you were going to tell somebody what to eat. So the way around that piece as a health coach is that you are sharing in a broad sense. We're not saying you must eat this, and we're not saying you, Michelle, must have this for breakfast, this for lunch, this for dinner. That would be specific nutritional advice that is particular to one person. So you can absolutely, though, share anything that is in the wider public range. And that's where we as health coaches come in, because we can absolutely share that. So there's a green state, which means anybody can share information. There's an orange state, which means you need to, there's kind of a middle of the road there, but the state has its own track. And then there's a red state, and a red state is where I think Florida was a red state. I'm not even sure where Florida is right now. You can still teach in the public realm, but you can't give specific nutritional information to an individual.
I was just thinking, I had a meeting with a doctor a year ago, and he was just asking questions that I really wasn't prepared to answer.
Mm.
But I was just starting out coaching. I
Mhm.
didn't have testimonials, or I was still working with practice clients.
Yeah.
So if you were going to have that conversation with a healthcare practitioner, or anyone for that example, where you want to learn about their business, but you also want them to learn about yours, what's
Mhm.
the best way to prepare for what would be a good thing to come with to that meeting?
Yeah. So, really, what I would say is that when you come to that meeting, you want to come with, first of all, an understanding that you're coming to learn more about them. And you also want to be really, really clear about your own ideal client. Like, who is it that you most serve? What is it that you do as a health coach? Because the health coach realm may or may not be familiar to them. And so, really, what you want to be able to explain to them is that you work in the realm of habit change. You work in the realm of habit change. So you're not diagnosing, you're not treating, you're not doing any of those things. You are helping people in the realm of lifestyle habit change. They get that. They know what that is. And they're going to be like, oh my God, thank you. Like, that is what they need support in, is helping their clients and their patients create healthier habits.
Yes.
They know that that's missing. They
Hmm.
know that.
Well, one of the things that this particular doctor said to me, and he was a cardiologist who has now gone into integrative medicine, he
Mm-hmm.
was saying what he looks for are the facts and the results.
Mm-hmm.
So I guess there's a little bit of educating, like you said, that may have to happen when you're talking to someone in the medical profession, because they
Yeah.
want to see what the results are, with you working with a patient or a client.
Um, maybe. I
Okay.
mean, I know that, they, again, if you are talking to them about, you are helping clients create healthier habits and you're in working in the realm of habit change, then what is he looking for? When he says he's looking at science and results, what specifically is he asking you for? Is he
I
asking
think
for?
I think what he was wanting to find out was what kind of results
Mhm.
was I what that I was getting from the type of work that I was doing. This was
Mhm.
like the very first
Yeah.
conversation that we had.
Right. So this is where you would just go to your practice clients and let him know. Like when I work with my clients, by the end of the 90 days together, this is what we're setting them up for. And
Yeah.
so you would share specifically, and this is kind of what I like to call your bold promise. It's not a guarantee. So remember, there's a difference between a promise and a guarantee. We can't ever guarantee results.
Right.
Neither can your doctor.
That's very true.
Neither can your doctor. So when he says, what are the results? He can't guarantee results. Nobody can guarantee specific results, even with a medication that has been tested over and over and over again.
Yeah.
So what we say is, that we work with a client over the course of a certain time period so that they can take these steps to have this experience of life or this experience of health or this experience of wellness.
Hmm. Yeah, I think what I knew now, if I could go back and have that conversation again, it would have gone a lot differently.
Mhm.
I
Yeah.
have more experience and confidence under my belt to
Mhm.
be able to answer his questions that I didn't
Mhm.
have then. But I'm still glad that I had that conversation because now I can reach back out to him again
Yep.
and
Yep.
let him know.
And
Yeah.
the other thing that I do, again, I went with them in with my program. I showed them this is my program. This is what we do in week 1. This is what we do in week 2. This is what we do in week 3. This is what we do in 4. And if they ask for resources, there's actually a resource page in that too. So I'm happy to share, resources. I tell them what it's based on. So again, it's based on, the nutritional aspect of it is based on my experience as a certified nutritional therapy practitioner, or that's what they called us then. Now they call us a functional nutritional therapy practitioner. So I would say that this is based on the science that was taught, and it is science-based. It was taught on the science that was taught in NTA. Now, here's this tricky part about science is that we all can find science to support whatever our most dominant belief is, right? So, if you are a proponent of veganism, you're going to find scientific articles that support that. If you're a proponent of paleo, you're going to find scientific articles like that. So there are multiple ways when we say, well, show me the science. Well, each side has its own science. Each side does have its own science. So I would say, it certainly, comes from, what is the experience? What is the result that your client looks for? And here's another thing, and I was able to share, some specific client experiences that I wanted to share with them. For example, and you are more than welcome to share any of these because you can also share experiences that other people have had, like health coaching. Like you can say, look, HCI has certified this many people. These are some of the results that we see people getting when they are engaging in the transformational coaching method. So you don't necessarily have to say, well, all of my people got this XYZ result. You can say that when people are experiencing going through the transformational coaching method, this is how we want to set them up for success. Or this is how we want to, help them create a new way of lifestyle habits. And Samantha's here. Oh, I'm so glad. So she says, love that. They certainly cannot. And if you look at their results, it's not always something to celebrate. She was talking about the doctors earlier, right? They cannot guarantee results. And sometimes even their results are not something that we can actually celebrate. But we know and we can see, and it is scientifically based, that when people are feeling in control and feeling empowered of the choices that they're making, and they have support and they have accountability and they have structure and they have somebody to guide them along, we know that results happen more quickly. And so you can even say, look, this is the reason why 98% of diets fail. We know that. So this is where you just get to kind of draw on your own experience and courage. And, you know, one of the testimonials that I used was one of my clients. He was actually a man, even though I worked primarily with women. You know, our ideal client is going to meet around 80% of who you work with. And he came to me and he was like, I hate shots, and my doctor is telling me that I'm going to have to go on insulin. I do not want to give myself shots. I do not want to go on insulin. And I told him, let me have some time so that I can see if I can do this on my, you know, with some help with nutrition and lifestyle. So he came to me, he says, I want to go through your program. I'm like, great. He went through it in 6 weeks. And again, it's a six-week program. In 6 weeks, he lowered his A1C numbers. He lost 15 pounds. He started working out again. He went back to his doctor. His doctor had to adjust his cholesterol medicine and asked him, what are you doing? So that's the evidence right there, is, you know, this is what is possible. Now, he did the work too, you know, and that is not, you know, not everybody is going to get those results, but he showed up, he did the work, he put in what he wanted to do, he followed, you know, the guidelines that I was teaching him, and he got amazing results with support, with accountability, with structure, with a program. So yeah, I would share, and you're welcome to share that story. Like that, you know, it is recommended by other, you know, doctors in the area, in my local areas. You can absolutely say that it is a program that is backed by
I
someone.
really, I really appreciate you sharing all of these things, because there are times that I think, do I know enough? Can I do this? And I know that's just fear talking, you know, um, but little by little, and I have made a list of people that I want to go and talk to and connect with, because I do know healthcare practitioners, nurses, massage therapists. So I'm going to get started on it this
Yeah.
week.
And, you know, he might also be asking questions because he himself is not really sure what he
Oh,
should be asking.
and he admitted to that, that he
Mhm.
didn't know anything about it. I actually ended up coaching him on the spot.
There you go.
I coached him and then I followed up with him too, you know, and so, yeah. So thank you, Chris. That was really helpful.
Absolutely. Yeah. Oh, good. So Samantha's got another comment in here. I'm so glad that she's here. She says, you're co-creating a conversation to find the best way to support their patient's health, not there to defend or prove anything. Yes. Oh my
Good.
gosh. So good. Thank you, Samantha. Take skepticism with curiosity, and that they're trying to protect their patients and their name, and not prove that you don't know what you're doing.
Okay.
Yes. Yes, 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 absolutely. So yeah, and that is the way that we present it. We want to help your patients. We want to help your clients. We want to help them have better results.
Mm-hmm. Do you have anyone else that's asking questions? Can I get off?
Oh, sure. Yeah, Stephanie's here. Gretchen's here. You don't have to. You're like, oh, do I have to keep asking you questions?
Yeah, I was
No.
like, do I need to keep the conversation going?
No, you're good. Oh my gosh, you're so cute. I love you. Barbara actually said, yes, I had a client like that too. Yeah, awesome. Hey, Stephanie.
Bye.
Hello.
How are you?
I'll take the heat off Michelle for a minute because I do have some
You guys are great.
So I think, and kind of where she was coming from, like I had gone to a few, I even found an integrative practitioner in my city, and I went in and I introduced myself, and she just kind of stared at me like deer in the headlights. I'm not really sure. I had printed up a little information on myself about who I was, what I did, what I, who I served. And I went in and I asked for a conversation, and the doctor came out because they weren't very busy. And she just kind of like went, oh, thanks, bye. So I thought it really took the wind out of my sails. And that was probably a little over a year ago.
Yeah.
So I have not gone back.
Yeah.
And I think what I'm looking for is maybe some clarity on making that initial contact. And I still have to finish all of yesterday's video. I didn't get to watch all of it, so there might have been a little more information there. But a really good way, now that I feel like I have a better sense of who I am, who I serve, and using terms like bridging the gap, which I
Mhm.
love,
Yeah.
between them getting, a diagnosis or some sort of information to the implementation. What I'm looking for some clarity around how to start the conversation.
Yeah. So first of all, I would say, again, cold calling, if we don't really know the person or if we don't really know the doctor, then it is hard. It's like making a cold call. And that's one of the reasons why step one is about starting locally and with who you know. So I know you started locally, but if you didn't know that, specific doctor, she may not have been open and welcoming. And
Yeah.
so, yeah, she wasn't. And I have had, I have gone in like, and just, it was actually another chiropractor. And I said, hey, this is what I'm doing. I'm in the area. And she actually said, because I was actually going to her place to see if I could like do a talk there. Would you be interested in hosting this? And she said, I'm really not interested in hosting that here, but please feel free to put your flyer up. Please feel free to, leave some of the cards and your postcards. And I'm like, awesome, great. So even if they don't have time to sit down with you or even have a, conversation, and again, I would recommend, connecting with them and setting up some time to talk with them. I was just bold that day and I just decided to walk in the office and say, hey, my name's Chris Williams. I'd love to chat with, Dr. So-and-so. Does she have 10 minutes? And they
that's
actually
what I
went back
did.
and got her.
I felt like I was sweating buckets. I was like, oh my gosh, I was so nervous. I know I stammered. I know I was, but it was one of those things. I just walked in and said, hi, I'm a health coach. I live here in the area and I'd love to connect with you.
Yeah.
And it wasn't a great experience, but
Yeah.
it didn't stop me.
Yeah.
But yeah, so I
Yeah.
can understand, like I do have a chiropractor and she actually has some of my flyers, but she won't post them. She says, if somebody asks, she's like, I would be more than happy.
Yeah. So here's the thing. When you have a specific course, when you've got a 6-week program, when you've got something specific, they are going to be more apt to post it because it is a specific resource and it's a specific class and it starts at a specific time versus just putting up something generic about, this person or this health coach.
Yeah, that makes a lot more sense. So
yeah,
I'm going to see her again in 2 weeks. So
cool. And I want to answer the question about how to open the conversation with them too. That is, we are going to them to learn more about them as well. So when I would go to them, hey, I'm Chris Williams. I'm a health coach. I'm also a nutritional therapy practitioner. And I would love to learn more about your business and who it is that you serve so that I know who best to refer to you.
I love that.
I know who best to refer to you. And so that allows, now their ears are perked up and they're like, oh, okay, yeah. It's not like this person is just coming at me for, promoting them, right? It really is showing that you want to have a collaborative relationship. And so when you're saying, who is it that you serve? Like, who would you like me to send you to? Do you have a specialty in something? Even integrative doctors, some of them specialize in certain different areas, right? Some of them specialize in hormones, some of them specialize in other areas. Even the OBGYN that the practice manager and the doctor that I got a chance to talk with, she has a specialty. And I went and talked with her and the practice manager to find out, like, what is the specialty so that I know. So we make it about them. We make it about how can we help them in their practice. And then we also share, and this is me, this is what I do. I would love to, share with you, a resource that I could provide for your patient to help them with XYZ results. And that is really the best way to open up a conversation because they want to build their business too. Sure. But nobody ever likes, to be sold to, right? So when we make it about them, just like when we make it about our clients, that works really well. Same thing when you are like, if you do go to a networking event, and you do hear that someone's a chiropractor, an acupuncturist, or a holistic practitioner. And again, holistic practitioners are really more open because typically they have lower amount of staff and they are also trying to build and develop and grow their business too. So they are more open to the collaborations because they want to build and grow their business. They want to have a steady stream of income. So as a matter of fact, sorry about that. Someone just texted me and it's came through my computer. So, so for example, the chiropractors that I met with, it was either a husband and wife or actually 3 of them together, and they wanted to collaborate. They were always looking for new clients. They were always looking for new patients. And so it allowed me to understand what was the method that they were using and who is it that they would, what's their specialty, so that I could communicate that to people. Not only my clients could I refer to them, but other people that I came in contact with.
Right. Oh, that makes a lot of sense. So
Mm-hmm.
yeah, being able to offer more service to them, putting
Mm-hmm.
their needs first. Yeah, that makes a lot of sense. So
Yeah, absolutely. And then that made it really easy, right? I would reach out and go, hey, I saw you, or we connected at this networking group, or, I saw you on the Zoom call or whatever, and would love to connect with you and learn more about your business and learn more about your client. Would you like to set up a time to do a Zoom chat? If somebody approached you that way, wouldn't you be like, oh, heck yeah.
yeah, I'm like, oh yeah, you found me. So I
Yeah.
actually think I'm going to reach out to my previous chiropractor because we did have a good relationship.
Mhm.
And even though she's like 30 miles away, referrals really, the mileage doesn't make a difference. But, when I left that job, I found a chiropractor closer to home. But I did have a good relationship with her, and she does have a pretty large client base. So, and she actually called me a couple of weeks ago just to reach out and say, hey, you haven't been here in a while. How are you? And I thought, you know what? It just dawned on me like, oh my gosh, she was doing that. She was connecting with me to check on me so I can turn around and return the favor.
Yep.
And reach out to her. So,
Yep.
but having that specific program, I think, will make that conversation a little less weird.
Mm-hmm.
Yeah. Awesome. Thank you.
Absolutely. You're welcome. Yeah. And you don't need, hundreds. I had 5 main ones, and they were absolutely open and willing to support me. I was open and willing to support them. I sent them clients. They sent me clients. It was a win-win. Again,
Yeah.
That's what we want to do. We want to create a win-win. So how can we best create a win-win with them?
Yeah. And I did I've referred clients to her in the past. So, I would, every time I went in, I took another stack of business cards and I was handing them out because I knew a lot of people that could use her services. So,
Yeah. Yeah, absolutely. Samantha says, just like coaching a client, listen and ask questions to get on their map. Understand them and what they do and how you feel you can best support to make it happen or refer the right person to them. Proud of you for not letting it stop you. Definitely a teaching moment.
yes.
Yay. Yeah, absolutely. Yeah. And I really just, I think that it just feels more natural to me when I'm actually just connecting with somebody that either I know or that somebody else knows, or, hey, so-and-so referred me. Hey, so-and-so told me that you might be a good person to talk to. I'd love to learn more about your practice. That's another way that you can open up the conversation that way too.
Perfect.
Yay. Cool. Any other questions for me?
I think that's it for now.
Okay, cool. Well, feel free to stay here. You don't have to leave Zoom once your question's answered. You're more than welcome to
Well, I'm in then.
stay here. Yay. Hey, Gretchen, how are you? Welcome. Do you have any questions for me? You don't have to show your face if you don't want to. You can absolutely just come off mute and ask me your question.
Hey. No, I'm completely new to the health coaching because I just now I'm in IIN's program and it finishes in March. So I'm wanting to learn as much as I can, like how people are doing business and stuff and getting started.
Yeah, great. So have you had a chance to see the day 1 and day 2 yet? Videos?
No, because I found you yesterday and
cool.
So I missed 1 and 2 because it was later at night.
Okay, no problem. And they're here in the Facebook group. So for those of you that are just joining me or just found me, you can go into the units section that's inside the Facebook group, and it is the Abundant and Empowered Feminine Leaders. And you can absolutely click on the unit section and you can catch all those replays. So this will also be there, as well as tomorrow night, we have a special guest that's coming on. It's another health coach who is also using the Launchwell program, and she's going to share her results and how she's built and grown her business. And then Friday, we're going to have Laura Machintino on, and she is a copywriter. She works with wellness coaches as well. And she's going to share a little bit about the 10 module creating content that converts course that she has inside of the program, as well as kind of share how you can create a message that is attracting your ideal client. So, yeah. So Gretchen, one of the things that we talked about is, step one was to really start locally and start personally with doctors or holistic practitioners that you wanted to work with. So if that's where you want to start, and again, you don't have to, but this is one way to grow your business. It is the way that I really built and grew my thriving health coaching practice. Was I collaborated with doctors and holistic health practitioners. And so some of those doctors were integrative doctors, some of them were chiropractors, some of them were acupuncturists, there was a naturopath, there was digestive health associates, an entire digestive health associates team. There was even a neurospinal doctor. And one of the things that made it really effective for me is that I wasn't going just to say, hey, here's my card, refer clients to me. It was that I was going to them with a specific resource. And I was creating a relationship with them first. And I was asking about, who it was that they served and how who would they want me to refer to them if they had a specific client that they wanted me to refer to them? Is there a specialty that they worked with? And we also talked last night about 4 different ways that you can actually fill your programs and offers. So be sure to tap back in and listen to that. But when you go to your practitioner, go with something specific, not just, hey, I'm a health coach, refer clients to me. And that was the game changer for me. And I did have a 6-week wellness program. And so I was sharing with them, this is how I work with clients. I have a 6-week wellness program. And this is what we do in week 1. And this is what we do in week 2 and week 3, week 4, week 5, week 6. And the intention of the program is to help them set up their foundations of health, as well as to create healthy lifestyle habits as well. And I just shared why I was passionate about it. I shared some, the reasons why I really wanted to help people reclaim their own health and wellness. And I just talked from my heart about that, but I let them know that there was a specific resource. And the reason why that's important is because now whenever they are working with their patients, they're going to be thinking about a specific resource versus just, who should I refer to this health coach, right? Like, we don't want them to have to spend their time trying to sell you to their patients, because they're not going to do that, and business cards end up sitting in a drawer. But if they really know that you have a resource that can help their patients, they are going to be more apt to refer their patients to you and to your specific program or offer, if they understand it.
Yes, thank you for that information. That's very helpful.
Yeah, awesome. Yeah.
Yeah, so I will. I'll go back and look in the Facebook group. I believe that I clicked join and did the questions, but I'll go back and look to see if it's available.
Yeah.
But yeah, it's all very interesting how you just put that together. So I'm looking forward to learning from you.
Oh, I'm glad to have you here. I'm happy to help. And again, if you have any questions, feel free to put, when you're in the group, feel free to reach out or post them in the chat, because really any of the questions that people have, typically someone else has them too. So
Sure.
It's really helpful when you ask, the questions. Did you have any specific questions about how you wanted to start your business?
Well, they've tried to drill us down in the program to pick a niche.
Mm-hmm.
And I was just curious as to whether or not anyone's ever gone in just as a general health coach. Like, do you have to have a niche per se?
Yeah, okay. That's such a great question. So it really is helpful to, and when we think about niche, I know there's a lot of talk about, niching down and making sure that you've got your hot hook and your elevator speech or your PMM or whatever they're calling it these days. Schools change it up. And here's what I want to say about niching down. It is important to have an understanding of who your most ideal client is. So being a general health coach, the reason why we don't want to just say, oh, I'm just a general health coach and I can work with everybody, is because people don't really understand what that means. And you really want to be able to talk specifically to the client that you can most serve and that you can most help. And so the language that you're going to be using is going to be specific to whatever pain point that she's experiencing on Pain Island and whatever result or solution she wants to have on Pleasure Island. And so when you're creating a message, you want it to be as specific as possible so that you're speaking to that ideal client that you most want to serve and that you most want to work with. So one of the things that I ask my clients, Gretchen, is when you're thinking about who it is that you want to work with, don't think about it as, well, what niche do I need to make money? What niche is going to help me make money? Come at it from a place of what are you most excited and passionate about? And really, when we get down to the nitty gritty, we are all our most ideal client. We're all our most ideal client, right? So what is it that you are really excited about helping somebody with? And that is going to guide you into what that person, that most ideal person is. You know, maybe you just want to work with women and they're in a certain age group. You know, it's helpful when somebody knows, are you working with stay-at-home moms or are you working with corporate C-suite executives? Because the message is going to be very different. Their pain points and their pleasure points, again, the pain points, what they most struggle with and that what their challenges are going to be very different, you know, from a stay-at-home mom versus a C-suite executive. And so if you don't have a specific client, you're not going to be able to have the languaging that is going to help to attract your ideal client to you.
Okay. Yeah, I could see where that would be helpful. I guess I caught into the general health coach idea because, you know, lifestyle changes, if that's what we're helping people do, that's pretty broad because everyone's going to have a different challenge. So that's why I was questioning that because it seemed to be where you could help anybody with a lifestyle challenge.
Absolutely. You absolutely can. So yeah, so let me just kind of, you know, affirm that. Yes, you can help anybody. But when we are talking in such a generalized term, nobody resonates with what we're doing. If we just say, I can help you create healthy habits, it kind of just goes over their head. And they're like, well, that's not me. What is health? What does creating a healthy habit even mean? Right now, if somebody is experiencing digestive issues, you know, and you're basically saying, I can help you reduce the bloating and that, you know, overly full feeling that you're getting and those digestive issues that are causing, you know, heartburn or acid reflux or whatever. Or maybe you're helping somebody create better sleep, better quality sleep, right? But there's specific things. So yeah, you can help people in a multitude of ways, but we really do want to be able to talk in a way that is using their words, their language. And when we get too general, we end up using health coach talk.
Okay, I understand.
And that doesn't resonate. Yeah. Yeah.
Yeah, that makes sense.
Great question. Thank you for asking it. Yeah. Any other questions for me?
For me, no, not right now.
Okay.
I'm just kind of feeling out the field, you know, how this all works. So I'm sure I'll have some later, but as of right now, no.
What are you most excited about helping people with?
Wow, that's the thing. I've written down so many different options that I could go with because we did an exercise that, you know, was trying to help find a niche. So I'm not really drawn to any one particular thing yet. But I really do have to work on that.
What inspired you to go into health coaching?
Just in general, just like if there were someone that just to help people. It was nothing really specific. I was just wanting to learn how to just to learn the field and transition into that from what I'm doing now. So I really enjoy. I think I would really enjoy working with people that are looking for better options, a better way to do things because they're tired of being in the traditional cycle and just continuing the Band-Aid method. You know, I see a lot of that in my workplace and it's disheartening.
Yeah. Yeah. So you have a passion for helping people not just put Band-Aids on things, but create solutions, or at least helping them find ways for them to create their own solutions and be able to take back control of their own health and wellness.
Yeah, so it doesn't hone in on anything specific, as in like, diabetes or,
Mhm.
the things that you've mentioned with gut health or
Yep.
with sleep.
Yep.
So that's why, trying to hone it in on something more specific is something I need to work on.
Yeah, and again, one of the things that I would suggest is tap into what is it that excites you? What is your why? What is your deeper why? So you obviously have a passion for helping people create, get out of this cycle, this traditional cycle of, well, let's just give you a pill for this. Let's give you a pill for this, that, and the other thing. But as you begin to work with clients, Gretchen, you're going to notice that you are gravitating and you really enjoy working with, a certain type of client in a certain way, shape, or form. So I think that we get to allow this to evolve. But we do need to start someplace with, and we start with that someplace of what is our deeper why and what are we most excited about and why are we excited about helping somebody with that. And it could be, maybe we've helped a family member with that, or, maybe we see people suffering and you don't want them to suffer anymore. So, those are our deeper whys. But
Yes.
let it evolve, like it will evolve. Like I know you're still in IIN right now, and taking a look and writing down, like what are some things that you would really like to help people with that feel really, again, it has to feel fun and exciting to you.
Okay.
Not just how am I going to make the most money? What niche? Because the truth is, you can make money in any niche.
Right.
Mm-hmm.
Right. Yeah, the money is secondary for me. I get, it fuels me
Mm-hmm.
and provides happiness to me to be able to help someone feel better.
Yeah. Yeah.
And then actually resolve and find solutions.
And what type of solutions are you noticing that they're looking for? When you say that they want to feel better, what do they want to feel better about? Is it a specific anything, or you're just still trying to figure this piece out?
Just in general, we're talking with family and friends. Like I did a couple health histories today.
Mm-hmm.
And so, working on blood pressure, weight loss is a big one.
Mm-hmm.
And pain, just physical pain.
Okay, yeah, physical pain, inflammation in the body
Mm-hmm.
creates pain too, yeah. So, I'll give you a couple ideas just in what my clients work with, and you can get specific. You can, work with women that have thyroid disorders or fibromyalgia or digestive issues. And I think emotional eating or weight loss or body image or helping women recover from burnout or adrenal fatigue. Like there are a bunch of different categories that you can go. But when you think about it, when you are saying, I am going to help you, refine your habits and help to rebalance your system so that the hormonal system works better, so that you're not waking up at night with night sweats and you are, able to release some of that extra weight that you're carrying around your belly. That is talking somebody's specific language. And we're just using really simple words to share where we see them struggling and where we see them suffering and the result that they want on the other side.
Yeah, that's good. That sounds good.
Yay.
So yeah, I'll definitely be working on that the rest of the week, trying to really nail that down because school's almost over and that's, the goal.
Yeah. And again, notice who is coming to you as well. Notice who's coming to you. I started actually as, a nutritional therapist and a health coach. And the interesting thing is that I began to morph and shift as I began to work with clients and learning more about how I could help them and learning more about what they were asking me for. So you can still allow that to morph and shift and evolve. I didn't go to HCI, Health Coach Institute, and their mastery program to actually be a business coach. That wasn't even on my radar at all.
Well, you
Not even in the
said,
slightest. And it began to evolve because people started asking me, how are you doing it? Can I learn from you? And I'm like, sure. And I started teaching what it was that I was doing. And so it naturally evolved into something else. And that does happen. things start to naturally evolve, and you listen to your heart and you feel those tugs and you're like, oh, I really want to help somebody with this piece, or, oh, I could really help somebody with this piece. This feels fun.
Yeah. Yeah, that's great.
Yeah, cool.
Great information. Thank you.
Yeah, you're welcome. Sonia McConkey, I'm so glad to see you here, my dear. Do you have any questions? By the way, you guys that are in Facebook, if you are not joining me here in Zoom, not a problem. But if you do have a question, type it in the chat. I am more than happy to answer any questions that you might have. Stephanie, did you have any other questions at all while I've got you here?
No, I don't think so. But I understand where Gretchen's coming from. Like, I remember in the beginning, you know, not really knowing, like, I just want to help everybody, but
yes,
it definitely does evolve. And I went from weight loss to, you know, natural weight loss without dieting. And now I actually work on the emotional piece. And a lot of my clients will actually start to see that we really have to work on the emotional piece first before they start to see the weight loss. But once they unpack all of that, that's when the weight loss happens. So I totally understand how it's, you know, it kind of had to happen. And it took me almost 2 years to really dial in and get super specific.
Yeah. Yeah. And it is an evolution. It is a process. So don't worry too much about, oh my God, I got the right niche, right? When we tell ourselves, oh my God, I got to get it right. I got to get the right niche. I got to figure this out. That creates so much pressure. Instead, you know, just like, what would I love to do? What would feel really good to me? What would feel really exciting to me?
Date them. You don't have to marry them. Date them.
Yeah, there you go. That's right. You get to try it on. And if you like it, great. And if you don't, say, that's not for me.
Yep. No, I get to change.
Mm-hmm.
I get to change.
Right. The clarity comes when we actually take action. So the understanding comes within the action. So we don't really know whether we're going to like it or whether it's amazing. We have an idea, we have a pull. And then when we work with somebody in that area, we can be like, oh yeah, this was like really fun. I really want to do this again. Or, you know what? I think it doesn't quite fit right. Like there's a piece of it that fits, but there's another piece that doesn't quite fit. So kind of like how Stephanie began to, you know, tweak hers. She wanted to work on the weight loss part, but she realized that, oh, you know what, there's a piece that's missing here. And I really want to use, this is what excites me, is when I see women really making those connections from the emotional aspect. Wow, when we get that piece, look at that, look how that opened. But we don't get there until we actually start working with our clients and start seeing how we could change.
Yeah. I can also see the connection between how that would work working with practitioners. Not every practitioner is going to be a good fit. There's going to be practitioners out there that, you know, are just not going to, I mean, especially the diet industry, I feel like that's one of the areas where you're either really far over here or really far over here, and where we kind of work from the middle out and try to see where the disconnect is coming. That, you know, there's plenty of places in the diet industry that would seem like a good fit that I've approached that are absolutely not.
Yeah. Yeah. And we don't know that until we try. I'm so proud of you for trying, for just reaching out. Yeah. And just trying and seeing, is it a good fit? Is it not? You know, there's some people that you might not like their personality, like that mean lady. I don't want to work with you. You're a meanie. You don't have to work with everybody, you know. And the other thing that I want to say is when you find a select few, you know, doors begin to open up. So, you know, the example that I used yesterday or on Monday, I think, was, you know, one of my clients that I worked with, she was working with a neurospinal doctor and she needed to lose 15 pounds in order to have back surgery. He said, I will not do this operation. I cannot do this back surgery unless you lose 15 pounds. And she was like, okay, how do I lose the weight? And he's like, well, just go find a program. And she's like, well, where's their program? And he's like, well, I don't know, just look it up, Google it, whatever, like. And so she went to her chiropractor. Her chiropractor happened to be one of my referral partners. And Jason was like, oh, go talk to Chris. Like, she can help you. And so she contacted me and she's like, Dr. Rose referred me to you. He said that you could help me with this. And I'm like, absolutely. I'd be more than happy to help you. I took her through the 6-week wellness program one-on-one because I didn't have a group going at that time. and she really wanted support. So I took her through the program. She lost the 15 pounds. She went back to that neurospinal doctor, and he was like, I want that. Who are you seeing? What are you doing? And can I have her card? And he began to refer patients to me, and his nurse would actually send me emails. So asking me, when is your next class? Do you have any flyers? So just because somebody originally doesn't, your referral partners can come in many different directions. It doesn't have to just come from us reaching out to them. It can also come from your clients and other patients and other referrals that are sharing your information as well. And that's where the referral with the Digestive Health Associates came. So I didn't reach out to them. They actually reached out to me because one of my clients who went through the program was a holistic nurse, and she had such amazing results that she ran into him one day and she told him what she was doing. And he was like, oh, I want to talk to her. I wonder if she would be willing to come in and talk to my staff. So I didn't reach out to them, but the opportunities present themselves when we are open to receiving those as well.
I just actually had a thought too. Like, a friend of mine lives in Florida 6 months out of the year and in New York 6 months out of the year. And she works for one of the top hospitals here. She's in the cardiac unit. She's a nurse. So yeah, like, oh my gosh, I never even thought about reaching out to her.
Yes. So start personally. Start personally. That really is one of the best ways when you meet people that you have a connection. And again, I didn't reach out to the hospitals. The hospital reached out to me, and it was only because of this holistic nurse that had been through my program. And she began, she actually began, messaging me and saying, oh, you need to go talk to this oncology doctor, and you need to talk to so-and-so, and you need to talk to so-and-so, and be sure to talk to so-and-so. So she was really an advocate for me because she experienced it. And that's another thing that I do is I invite them to go through the program if they want to. The Digestive Health Associates, they didn't have time to go through the program, but I did show them the program, and I showed them, and I, had a binder of this is what I'm going to be doing. And they were so super excited about it. And they even began to brainstorm there. I remember I was sitting there, and one doctor was like, oh, this might be really good for these patients that are trying to lose the weight over here. And they're doing, I don't know what the technique was that they were doing. It was something with a balloon that they were putting in the stomach or something. Honestly, I don't know. But they're like, oh, this would be like a really good support system for these people after they've had this procedure, to help them with this, to really create these lifestyle habits so that they don't fall back and gain all this weight again. Right? How many people do you know, not only have they maybe lost the weight, but I know people who have had mommy makeovers, and people who have had tummy tucks, and people who have had bariatric surgery, and they end up gaining the weight back. And it's because they don't have these lifestyle and habit changes set up.
Absolutely. And that's always what happens, especially in this particular industry, especially with the emotional side of it. You can lose the weight. That's really not the hard part. But if you don't solve the emotional piece first, you're going to see yourself, and I call it looking at yourself with fat eyes, but you're never going to see the progress you've made because you haven't healed the trauma that usually caused it to start in the first place. So setting up support and having the accountability, and so would you recommend printing out the program, like you said, in a binder? That caught my ear. Like printing out what it looks like and having like the handouts, the worksheets or whatever?
Yep. What I did is I printed out the entire 6 weeks, and that is what is inside of the Launch Well program. Is you get 6 weeks, an entire 6-week wellness program that you can use exactly as it is. You just take my name off. You can put your name on, or your email and your logo and all of that. They're inside of Canva, so it makes editing really, really easy to do that. And print it out, put it in a binder, and just say, I would love to show you how I could support your patients again after, when it's your turn, right? After we've created that connection, that relationship, and then show them, look, this is a resource that I have for your patients, and I would love to share it with you. By the way, if you would love to go through it, I'd love to have you be my guest. And that's really what I did, is I invited them to be my guest and go through the program. That way they could actually see and experience results if they wanted to.
Yeah, that's awesome.
Yeah, funny story. I actually had a doctor go through my program, and he was a member of my church, and he has been in medicine for 40 years. He's retired now, but he was still in a family practice. And it's so funny. We were in the program, and part of the church had a function, and it was like a wine night where they were doing something for a fundraiser. And he had this sheepish grin, and he was like showing me his wine, and he's like, here's a doctor apologizing basically from across the room that he was embarrassed that he was actually not following the program or whatever. And I just had to laugh. It was really funny.
That is funny. Yeah.
Yeah. So that is really helpful when you have that resource and have a binder. And they're not going to read all of it. They're just going to see really what you want to do is show them, this is what we're going to do. Week 1, this is what the focus is. Week 2, this is what the focus is. And this is why it's important. So really what I do is I share the what and the why. What is it? What is going on in week 1? Why is it important? What is going on in week 2? Why is that important? What is going on in week 3? Why is that important? So that they understand the intention behind the program and the system.
Mm-hmm.
Yeah. Cool. Any other questions in Facebook land?
Oh yeah, I have something I wanted to ask now.
Sure.
So you just mentioned about the physician
Mhm.
being in the program, and it just caught my attention. Like, has anyone actually that you know of nailed down that as their niche? Like, because we're thinking about helping their patients, but
They need help
the
too.
doctors are actually human too, and they're so busy.
Yep.
I'm sure that a lot of them will probably appreciate that one-on-one time with somebody.
Absolutely. As many of my clients actually work, and maybe they were a nurse at one point, and so now they are also working with nurses, or working with people that are in the medical community. One of my friends has another friend who's a coach, and she actually works specifically with neurosurgeons. So talk about a specified niche, not just doctors, but she's working with neurosurgeons.
Okay. Good.
Yeah, totally. Awesome. Great question. So I'm looking for questions in the group. I don't see any. So if there's no more questions from Gretchen or Stephanie, it looks like I cannot believe we went through an hour already. Holy cow. Okay, so we're going to close it up here. For those of you that are watching the replay, please feel free to post your questions in the comment. I'm happy to circle back around and answer them. And just as a reminder, also for those of you that are just joining me, the Launch Well program is open for enrollment now. And so I did share the link inside the Facebook group. I will share it again. We've got a couple amazing bonuses if you decide that you want to invest in the program by Friday evening at midnight. One of the bonuses is the content that creates. It's a 10 module content that converts. So it is a 10 module course on how you can actually uncover the language that you can help your ideal client with. It's also going to help you uncover your ideal client, by the way, and how you can actually create Facebook posts or messages or any way, emails, things like that, so that you can really attract your ideal clients. You don't feel like you're always chasing your ideal client. I'm also gifting you how to create a 90-day content plan. So the questions that I get a lot from my clients are, I don't know what to post. I don't know where to post. I know I should be posting, but I'm not sure what and I'm not sure where. So I am gifting you a free 90-day content plan. And so that is also a bonus. And the last bonus is you get an entire year inside the Launchwell community, which is a Facebook group where I go live once a month so that you can ask me any questions wherever you are in your business. So you basically have support with me for the entire year. And it also comes with 3 one-on-one coaching calls with my associate coach, Sherry. And she uses the program. As a matter of fact, her husband is an osteopath. Her father-in-law is also a doctor, and he went through the program as well. So I'm so glad that you mentioned that, Gretchen, because yeah, there are doctors and there are medical practitioners that want to learn more too. Yeah, great. So, hey, Caro, so glad to see you here. Oh, I see another question. So Jennifer asked me, will this be provided as a replay as well as the day 1 and 2? Yes, it absolutely will. So it's streaming right now into the Facebook group. So you can just come back on here anytime, Jennifer, and feel free to rewatch it. There will be, now it won't be up forever. It will be up just for a limited time. So I am going to be taking these down on Sunday. So be sure to go into the units section and you can watch them. You can watch all the days, but it is going to be coming down on Sunday. So the link, I'm going to post the link here in the comment section, Jennifer. The investment for the program is $1,997, and that gets you more than just the 6-week wellness program. Not only do you get the entire 6-week wellness program to use as is, or you can edit, you can decide to take stuff out, you can decide to put stuff in, totally your choice. You get to white label it, which means you get to rebrand it. And you get an additional 5 extra modules inside of the course on how to fill your program and how to collaborate with doctors and health practitioners, in addition to how to actually run a group program. So how do you actually take a group through week 1? How do you actually take a group through week 2 and week 3 and week 4 and week 5 and week 6? Because that's another question that I was hearing is, I want to start a group program and I don't know how. I've only worked with one-on-one clients, so I'm not really sure how to do this. And so I basically take you through the program, through the entire 6-week wellness program, and I teach you how you're actually going to use those materials and how you can actually run a 6-week wellness program. So you can make 3 payments of $750, or you can make 1 pay in full payment of $1,997. And then those bonuses come with it too by Friday night. All right, my friends, I am going to pop off. I'm going to go grab some dinner with my family. And I look forward to seeing you back here tomorrow night. Even though we finished the content piece of this, I am bringing on 2 guests to show and to answer your questions on how they are currently using the program. And the other thing that I want to share with you is $1,997, that is something that you can absolutely make back within your very first group program. And you get these materials for life. So any updates, anything that I do that's different, any additions, it goes back in there. You have it completely for life. It also comes with a free recipe guide in there that you can use. It comes with PDFs and handouts. It comes with marketing materials. It comes with everything that you need to share with the doctors or to share online. So we even have some Instagram posts. You also have my swipe files. So all of the emails that I used for my 6-week wellness program. So what were the emails that I sent out to the clients? You have access to all of those as well. It really is jam-packed. So be sure to go to the page. And by the way, the website is shineabundancenow.com. So if you go to shineabundancenow.com and click on the Launch Well program, it will tell you everything that's in it, and it will take you week by week as to everything that's in there too. One other thing that I did want to mention about it, and that is you do not need to wait for an entire 12 weeks. If you wanted to binge watch this in a weekend, awesome. You get all of the information so you can go through it at your own pace. You can go through it as quickly or as slowly as you decide that you want to. So thank you, Jennifer. Thanks for asking the question. All right, my friends, have a great evening. I will see you back here tomorrow night. And then don't forget, we have got Laura in on Friday night. She's going to talk about how to create compelling copy so that your ideal client self-identifies and so that you can attract ideal clients to you rather than chasing after them. Have a great evening.